Hi, my name is Scott Brown, and I'm the president and CEO at AD Vault. Our Chief Product Officer, Mike Munoz, is also here to demonstrate how our healthcare provider tools streamline the process of incorporating advanced care planning into your clinical workflows, engage patients and loved ones in advanced care planning discussions, document and report on advanced care planning interactions, and query and retrieve advanced care planning documents at the point of care, whenever and wherever they're needed. Investing in digital advanced care planning helps everyone in the healthcare system better serve patients and families, including hospitals, post-acute care organizations, and physicians. My Directives for Clinicians delivers three principal benefits. First, it saves money. Second, our tools help you grow your revenues. And most importantly, our digital advanced care planning tools positively impact patient and family satisfaction, reduce clinical burnout, and help achieve clinical excellence, all of which boost your 5-star ratings. AD Vault developed a comprehensive solution that makes advanced care planning easier for everyone in the healthcare ecosystem. Its intuitive, modular design allows secure, anytime, anywhere access to advanced care plans across the globe. Let me take a moment to quickly walk you through each of the solutions. The original consumer-facing My Directives application guides patients and their families through the advanced care planning process in the comfort of their own home. Once completed or uploaded, patients can share their documents with family and providers. Both paper-based and digital documents from all channels are housed in our AD Vault Exchange, a proprietary advanced care planning document registry and repository. APIs allow subscribers to insert, query, and retrieve advanced care planning documents and portable medical orders from the AD Vault Exchange. Hospitals and healthcare systems can integrate My Directives Enterprise directly into their native EHR to quickly access and use advanced care plans across the continuum of care and to invite patients to create a My Directives account and create or upload their advanced care planning documents. My Directives for Clinicians empowers trained facilitators in long-term and post-acute care organizations to have interactive, productive conversations with patients and their families. You'll see more of this application in the demo. Finally, payers and providers leverage My Directives reporting and analytics for standard and ad hoc reporting and to enable business insight on advanced care planning program penetration and performance. So what is My Directives for Clinicians? As you'll see in a moment, it's a responsive, progressive web application that works across all platforms. This means clinicians out in the field can conduct advanced care planning conversations using their smartphones, tablets, and laptops. And administrators in the office can review reports and management dashboards on their desktops. Some common concerns we hear are that incorporating digital advanced care planning into clinical workflows requires a heavy technology lift, or it adds time to staff's already overwhelming workload. But that's not the case. In fact, our solutions leverage the native functionality that exists in your existing electronic health record or EPCR platform. Although no integration is required, providers may choose to launch the My Directives for Clinicians solution from inside their EHR to save time. We designed our tools to be modular, customizable, and interoperable. You can select and implement only the solutions that meet your specific objectives and avoid paying for functionality you don't need. Is chronic care management a critical component of your primary care practice? If so, we may suggest this combination to support advanced care planning and post-document completion. Do you think advanced care planning could be valuable, but you're not sure how to set up a program? My Directives for Clinicians helps trained facilitators engage your home health and skilled nursing patients and their families in advanced care planning with this tool set. These tools help social workers evaluate and document patient frailty and mental acuity, and then send patients an email invite to use our consumer-facing My Directives solution. It allows families to start advanced care planning in the comfort of their own home. Are you an EMS agency that's primarily interested in locating a do not resuscitate order or a POST form in the field? Great. We have an API that lets you query and retrieve those documents in real time directly from within your EHR or EPCR platform. And now we've come to our demo. I'm going to turn it over to Mike to walk you through these capabilities so you can get an idea of what's possible.
Great, thanks, Scott. As you can see, My Directives for Clinicians is a web-based application. In fact, it's a progressive web application, which means that all of the features and functions that you would typically find on a mobile application that you would install natively on a device can be found in this web experience. So all you have to have is a device with a browser to access the My Directives for Clinicians app. Users, when they come to the login, can actually create an account, or if they've already got credentials, can log into their existing system. Their credentials will actually determine the role that they serve in the organization and also drive the modules that they've got access to, very much like Scott showed earlier, depending on your role in the healthcare system. But once you log in as a user, the very first thing that you need to do is generate a patient search. So we can come in here and see if the patient that I'm working with actually has an advanced care plan in our system already. And of course, Debbie Jones does have a record in our platform, so I can verify additional contact information to confirm that it is her that I want to work on. And if everything matches, we can pick Debbie, and you'll now see the dashboard for My Directives for Clinician. Again, these modules are based on your role in the organization and what you subscribe to or need as a user. You'll see Debbie's patient information here in the header. Again, just to confirm that it is Debbie that you're working on. And you can look at all of the information that's stored in our 80 Vault Exchange for Debbie prior to doing any work on advanced care planning updates or uploading of documents or creation of any plans. So if we go back to the dashboard, we can click on Digital Advanced Care Plan. And if you're familiar with the My Directives platform, you'll notice that we have the same 4 areas of information that we collect. So if we expand on that, all of these should look familiar. From a user perspective, we did try to optimize the system so that if a user is using My Directives for Clinician on a mobile device, that it's very easy for them to navigate using their finger. So you'll notice that all of the answers in the system are targets themselves, so you don't have to worry about clicking on a radio button. And also, anytime I make a change, you'll notice the system give you an alert letting you know that you'll have to re-sign the document if indeed you do save a change to this individual's advanced care plan. We'll go ahead and click Save for now, and then briefly look at some of the other questions in the system, just so you get an idea of the data that we collect. But this can be done very quickly with a conversation with the patient. We can save those changes. You'll notice here now that it indicates that my document is not signed because we did make a change. So if I jump over to Healthcare Agent, you'll notice here that we've already got 2 healthcare agents in the system. I can see the information that we have stored for that agent and what powers have been granted, or I can also add a second alternate healthcare agent with name, title, contact information, relationship, and the powers that you wish to grant. We won't add a new one here, but we'll go back to the dashboard. So again, we made a change to the advanced care planning document. In order for it to be available in Debbie's record, we do have to re-sign the document, and we have 2 places we can do that. We can click on Signed here in the alert, or we also have an area here in Debbie's toolbar information where we are allowed to sign. And if you're on a device and the patient's able to sign on the device, they can simply use their finger to initiate the signature. The facilitator, which is the person that's actually logged into My Directives for Clinician, can also do the same. If for some reason Debbie's not able to sign on the device, we also have the option here to note that Debbie gave a verbal consent to digitally execute the document. So once we hit submit, we'll generate a brand new advanced care plan with all of the updated responses and brand new signatures. And that typically takes a minute or 2 to generate, but when we go back to our dashboard, you'll now notice that the plan has been signed. And again, within a few minutes, it's available in our document list. While we're waiting for that to show up, we will talk about the document upload capability. So of course, when you're engaging a patient, a lot of times that patient is going to come into the office or into the hospital with a paper-based document. So we do have the ability here to upload, and we do have functionality that allows you to digitize that document. But let's say Debbie has a do not resuscitate order. So we can name the document. You can select the type of document that it is, and you'll notice here we've got a long list of documents that we support, both branded forms like Caring Conversations and 5 Wishes documents. We also support the VA form, 10-0137. We also have generic documents like those that would be created with an attorney. And then, of course, a full slew of portable medical orders, including MOLST, MOST, POLST, and POST. But in this case, we'll pick out of hospital DNR, specify the date that it was created. And then in this case, I'm going to pick a file, assuming it's already been digitized. We'll get a preview of the document just so that we can verify that we did indeed select the correct document. And if all looks well, generate an upload for that file. So we'll take that document, upload it, and attach it to Debbie's record, and it will show up on the document list. So again, we'll give that just a second. So if we go back to our document upload, you'll see that we now have the digital advanced care plan that we made changes on earlier, as well as Debbie's DNR document. Next, let's talk about portable medical orders. Of course, one of the roles in the healthcare system is that of the doctor. So we do have the ability here with MOST and MOLST forms to generate these documents electronically. So if I pick the Maryland MOLST, for example, again, you'll notice very much like we had on the advanced care planning form, very easy for the user to come in and make the selections required just by clicking on the answers. So we'll go ahead and fill one out quickly. If there's any additional orders, those can be input. You'll notice that, again, the user that's logged in, its credentials will show up here. So as the practitioner, I would come in and again, sign the document, click save, and all of those responses will be populated into the Maryland MOLST form. So now you'll see that this document's been added to the document list. And when we go view it, all of those responses have been fed into the current version of the Maryland MOLST document, both front and back pages. Recording a video is a new option that we've added to the system, which allows you to take a recording of either a patient or a healthcare agent to reinforce the decisions that they're making as part of their advanced care planning process. And you'll notice that we've got several different options here, like recording a preference for location of care, which is something that came up as a result of COVID, when we had patients that preferred to receive treatment on site versus being transferred to a hospital because of a fear that they may contract COVID. But we have the ability to reinforce decisions on healthcare proxies, any sort of life-sustaining treatment, organ donation, CPR preferences, and any other notes or comments that they want to make about their advanced care planning options. So we can click on this. Again, you'll see the ability to generate a video. We do have the ability to store customized scripts. So if we need to help the patient with any reminders of information that they should provide as part of the recording, we have the ability to do that here. And then last but not least, we do want to talk about reporting. We do have extensive data that gets captured as part of this process. So let's jump over to reporting. So now we're in our reporting tab, and you'll see we've got some summary tiles at the top that show you the number of sessions that have been conducted by this logged in user, number of documents that have been completed. Of course, you can generate queries by date range. So if you want to look back for a full quarter or even a shorter period of time, you've got the ability to do so. But you'll see here activity for Debbie Jones. And this will show you all of the different sessions that were conducted for Debbie and the duration of those sessions. And you can even come in and look at the detail of the transactions that took place in that session. So if you remember, we uploaded an out-of-hospital DNR. We re-signed the advanced care plan. We looked at the healthcare agent information. And earlier, I voided some documents in the system. All of that was captured with all of the detail, and we do have the ability to export that data via Microsoft Excel. So if that data needs to be merged with other information at the healthcare provider level, they've got the ability to do so. So that wraps up the demo for My Directives for Clinician, and we look forward to hearing more from you about our tools.
Thank you, Mike, and thank you for taking the time to join us for this webinar. We hope we've given you a greater understanding of AD Vault's healthcare provider tools and our approach to digital advanced care planning.